Hello everyone, my name is Danny Debonis and I'm a senior neuroscience major at Union College. I'd like to thank SPSP for the opportunity to present my poster, and I'm excited to talk to you about my research. Now before jumping into that, I just wanted to shout out my fellow lab mates who are also presenting at the SPSP conference and wish them the best of luck. You can check out their presentations at the times and locations listed here. So my study examined the moderating role of masculine honor beliefs in male body checking procedures, and I want to start off by discussing masculine honor beliefs. This ideology holds the respect of a man's family, property, and reputation as the most important aspects of that man's life. Our focus lies in the tough reputation that these men strive for. A large part of fostering this tough reputation involves developing muscular and intimidating physique. This heightened drive for muscularity may put these individuals at a higher risk of muscle dysmorphia, a disorder characterized by the self-detrimental pursuit of a lean and muscular appearance ideal. Now, a maintenance factor of muscle dysmorphia and eating disorders in general is body checking. So body checking can be understood as any thought or behavior aimed at assessing one's size, shape, or weight, and these behaviors are found to be more negative and more prevalent in eating disorder populations. In attempts to curb these negative behaviors, various body checking interventions have been created, and two such procedures were used in our study. We used a positive body checking condition, which tasks the individual to look at their body non-judgmentally and to focus on strengths, and then a critical body checking condition that tasks the individual to focus on traditional hotspots or problem areas and their weaknesses. So our hypothesis was that men in the positive condition would experience an increase in body image satisfaction and self-esteem, with men higher in masculine honor beliefs experiencing a greater increase. Men in the critical condition were expected to experience a decrease in body image satisfaction and self-esteem, with men higher in masculine honor beliefs experiencing a larger decrease. Our findings didn't support this, however, and masculine honor beliefs did not play a role in body checking. Furthermore, the body checking tasks in general didn't affect the men in our study, which leads us to one of two conclusions. The first would be that non-clinical men do not engage in body checking enough to be affected by body checking procedures. However, we know this is not true via previous research, and this leads me to our second conclusion, which is that body checking procedures don't affect men in the same way that they affect women. So this point could take future research in a few different directions. One could attempt to continue tweaking body checking procedures in an attempt to make them even more male specific in hopes that they would produce the expected effects in body image satisfaction and self-esteem. Or future research could focus on using previously established body checking procedures and examine different outcome variables, such as feelings of vulnerability, anxiety, loss of control. Now, interestingly, our study did find a correlation between higher masculine honor beliefs and higher body image satisfaction, as well as higher perceptions of one's ability to intimidate and defend against threat, but not with muscle dysmorphia. So this correlation between higher masculine honor beliefs and higher body image satisfaction is particularly interesting because it may point to a lesser risk of eating disorders and body image concerns in men higher in masculine honor beliefs. So to finish our discussion with the body checking aspect of this study, there's been a large prevalence of reported body checking issues in both men and women, despite our study not finding an effect. So future research should examine these implications further to better understand the negative impacts of body checking in men, possibly focusing on further development of male-specific body checking tasks like the one used in this study, or examining different outcome variables with previously established body checking tasks.